month of March, we are celebrating women in healthcare with Cimas. My name is Miss Red, and today we are located in Windsor Park in Roa. Now, today we're going to be meeting a fantastic, phenomenal woman by the name of Dr. Jemedze. She's so amazing. She's an obstetrician, she's a gynecologist, and she owns her very own hospital. So let's go inside and just find out a little bit more about what she is all about. Let's go. Very special thank you for finding time to talk to us, Dr. Jemedze.
Thank you very much for inviting me.
So the month of March is a month to celebrate women, and women like you have done so much. Now, in terms of healthcare, I know you're not only an obstetrician, but you're also a gynecologist, but I want to go back to the beginning, and maybe you can tell us who you are from your point of view.
Who I am,
Yes.
I'm a grandmother. I'm a proud grandmother of a 4-year-old boy. I am a proud wife.
Mm-hmm.
And I'm a mother of 3.
Wow.
2 girls and a boy.
Okay, so when did this magical thing start?
I did my first degree. Funny enough, I had 8 points at A level.
Really?
Thanks to Affirmative Action, which was there then,
Yeah.
which allowed me to get enrolled into BSc General.
Mm-hmm.
So during my BSc General, I ended up having my 2 kids.
Mm-hmm.
And I had 5 years doing a 3-year degree program. The other year dedicated to my daughter, the other year to my son. And when I finished my 5-year, 3-year program, my husband encouraged me to go back to school because he knew I wanted to be a doctor.
Wow.
So I went to medical school, asked what it is that they wanted. They said, before you finish this degree program, we'll still use your A-level 8 points.
Mm-hmm.
And they are not enough. So we need a degree class, first class or 2-1. So I managed to get a 2-1 and I got a place into medical school. So when I went to medical school, I started and I was learning with people who were 5 years younger than me.
Wow.
So, and I was a mother of 2.
Yeah.
The good thing is I was driving, they were just students. So there were positives and negatives. And yeah, after that, I then worked at a rural hospital, now Salim Gabe, and then started my surgery in 2006, and I've never looked back.
Yeah, it looks like it. I mean,
Yes.
I've been looking
and
at your
in 2009,
establishment.
specialized, became an obstetrician and gynecologist. I was a GP for a few years.
And then you specialized.
Yes.
Because I was going to ask that, the difference between an obstetrician and a gynecologist, what are the two things? And the
Okay,
differences?
so people say, my gynae, but I am an obstetrician when I'm dealing with pregnancies, and I am a gynecologist when I'm dealing with the women's reproductive system. So gynaes deal with non-pregnant women, and obstetricians deals with pregnant women. But we are happy to be called the gynaes.
Yes, it's
It
okay
works.
either way.
Either way it works.
Okay, you're a very busy lady, and you know, I really was looking at your establishment, all the things that you guys do. You've got ambulance services, there are people lining up to be seen by you. You were just doing an operation a couple of minutes ago. But one of the things that I always like to ask women like you is, how do you find the balance of life? Like, is there such a thing as a work-life balance?
Work-life balance is not possible without a strong support. My husband played the mother during the years that I was in school, because I did my BSc, and then I did my medicine degree, and then I did my master's in obstetrics and gynecology, and then I did an MBA on top of that to just cement it. So during all that time, believe you me, baba, mama. Yeah, so that support really helped a lot. Yes.
So support system is always important.
It is always important to find balance. And also thanks to our house helps. They were so helpful. I tell young mothers that, you know what, just have as many kids as you want. Just have them, you know. And then when they're all grown, you'll be like the proud mom. It's okay to find time to be there. It's not easy, but it has to be done.
But you're doing it. You're doing it. All right. So proud grandmother, proud mother, proud wife. What does this woman do outside? Like, what do you do for just for yourself?
For me, I love going for holidays. Good enough, I've got an upcoming surprise holiday, but every end of year for my birthday. I get surprise holidays, so many of them, thanks to my husband.
Yeah.
And Sundays, we go to our construction site. Push amabara.
So it's your way of relieving.
It is my way of relieving. And in between, most of the time when I'm alone, I like being alone because when I'm alone, I've got so much time to listen to the word.
Yes.
I like listening to the word and meditating. So I don't have many friends because my schedule is so busy. Yes.
Okay. I'm going to take you back a little bit because I think a lot of women sometimes have challenges in the workplace. And for you coming up, I mean, you've had being a mom, trying to get into this profession, not having enough points, but making sure that you've pushed enough so that you can actually qualify and do plus. What are some of the things for maybe decision makers that need to be done in order for women to maybe have more space in the healthcare sector?
I think for women, especially in the medical school, the quota system, the affirmative action, I'm one proud product of that. And if I had just been ruled out, now that people are getting 20 points, this one with 8 points can't do it, then off you go. You need 3 points to do medicine. But because of the competition, now we need 15 points straight. I think, well, I know the women's right side of things. I don't believe in that. But women should just get their quota in the medical school to just say, quota. And with this all going on, we as Aiden Hospital, we've just said, what, probably we're not doing enough, but we need to start somewhere. So we have initiated a process of approaching the medical school to just look for one lady who is underprivileged that we can support throughout her medical school.
Wow.
This is a starting process. As we grow, we hope to get more, but we'll start with one. And the good news is, as of yesterday, she was confirmed, and we are excited to be part of that, supporting women, because the fees are just steep.
They can be a lot.
Yeah, and you want something that then lives after you are gone.
Yes, your legacy.
Yes.
Very important. So one thing you'd love to tell any woman listening, whether they're in whatever industry they are, because we're celebrating women in this month, but one thing that you think every woman should know, or some piece of advice or inspiration to someone who may be watching right now?
My inspiration is, at some point ndakatombotengesa madhoiri. It's red. Vanhu vandakatengesa nawo madhoiri vachiri kutotengesa vamwe vacho. So if I go back to Kariba, at Kariba Heights, they'll say mwana wedu adzoka. But that taught me to be a vendor. That's me. So even as a doctor, it's not difficult for me to maneuver. I get all kinds of clients and I serve them perfectly well because that background, so wherever you are, the sky is the limit. You can start from anywhere, and as long as you have this drive that I really need to keep going, I need to keep going. So like this Aiden Hospital, for me, it was a dream come true because I was a mother. Being at other hospitals, coming home, trying to balance things was difficult. So I said, what's a better way than bringing the hospital at home so that I can just be working from home to work and back? And it's working perfectly for me.
Dr. Jemedze, you've been fantastic, and we hope to see more of you and hear more of you. I know you've done so much work, and I also look forward to the legacy that you're going to leave.
Thank you so much. I'm so humbled.
Finding time, I'm going to go and look around and see the rest of the establishment, if that's okay?
It is okay. I can actually ask the matron to take you around.
Okay.
Then you can see and do other things. Thank you so much. I'm so humbled.
We celebrate you.
Thank you.
So the theme for this month, Women's Month, is Invest in Women, Accelerate Progress. And she's certainly doing just that.